Why Give a Buck is proudly brought to you by Just Peoples, an international non-profit that directly connects givers and doers to address global poverty. Hello and welcome to Why Give a Buck. I'm Johanna de Burker.
And I'm Christy West.
Each month on Why Give a Buck, we highlight innovative individuals tackling poverty in their local communities across Africa and Asia and explore why we should give a buck.
Today we're speaking with an incredibly powerful Kenyan woman, Lea Kilenga. Lea and two of her siblings were born with sickle cell disease, the hereditary condition that's very common in Kenya and the African continent as a whole, but still widely misunderstood. After losing one of her sisters to sickle cell when she was just 4 years old, Lea went on to experience the traumatic stigma that patients suffer as a result of widespread misunderstanding of this illness. Lea couldn't bear to see sickle cell carriers die unnecessarily and suffer throughout their lives, so she decided to make a change.
Lea founded the Africa Sickle Cell Organisation. Her mission is to create a society where people with sickle cell disease can live normal and fulfilling lives. As Lea aims to set this precedent for others by living her own life to the fullest, while taking on the challenges of advocacy work, both at local and global scales. Her story is heartbreaking and inspiring in equal measure. Lea, huge welcome to Why Give a Buck.
Hi, Joe. Hi, Christy. Wonderfully to be invited. I'm looking forward for the conversation.
You grew up in a rural village in Kenya. Would you mind painting us a picture of what life is like there?
I grew up in a rural place called Taveta. It's in Taita Taveta County of Kenya. It's a coastal county. We are right at the border of Kenya and Tanzania, and we can see the beautiful views of Mount Kilimanjaro from where we are. We are surrounded by very beautiful wildlife, giraffes, elephants, antelopes, zebras.
Wow.
We have a very small population. We are about 380,000 people spread across a very vast piece of land. And we are mainly agriculturalists. So we grow a lot of bananas, a lot of mangoes, a lot of coconuts, a lot of peppers, onions, tomatoes, maize and beans. I actually come from a generation of farmers, and I was raised and taken to school through farming.
Fabulous.
You listed all of those beautiful animals. Could you actually see them around your village?
So the only animals that interact with us very closely are the monkeys, because they come and eat the bananas and they come and eat the mangoes. So that's the downside of having this kind of wildlife close to us and our farmlands.
Oh, thank you for painting that beautiful picture of your community, Lea.
Yes, what a wonderful, vibrant community. But apart from those cheeky monkeys eating your crops, you guys are facing another big challenge, right? With extremely high levels of sickle cell disease.
Yes, so 24% of people in Taveta carry the sickle cell gene. They can be a carrier or a person living with sickle cell.
Wow, that's huge.
So huge. So around a quarter of the population are affected by sickle cell. Lea, can you please tell us what exactly sickle cell disease is? And can you describe what it feels like for those who carry it?
Sickle cell disease is a genetic blood condition that changes the shape of the round red blood cells into sickle-shaped red cells that do not carry sufficient oxygen and nutrients across the body. The biggest complications of sickle cell is due to the lack of sufficient oxygenation of the organs, the obstruction of blood flow to the organs and to the different parts of the body, causing severe pain, causing organ damage, causing things like strokes, complications with the major organs, and eventual death. But the biggest symptom is severe intractable pain. And it is said that up to 90% of children born with sickle cell do not make it to their 5th birthday because of all these complications that come about with having sickle cells in your body. Sickle cell came about when malaria came into existence and people started contracting malaria. Over years, people developed an adaptive gene that covered them and prevented them from contracting malaria. And this gene was the sickle cell trait. So they were protected from severe forms of malaria within the areas that they lived in. However, when two people with this sickle cell gene or with this protective gene against malaria come together, then they have a likelihood of having a child with sickle cell anemia. In Kenya, like anywhere in the world, where there is malaria, there is sickle cell. Because generally people develop these genes, generally people intermarried, and in those areas, you have high burden and high prevalence of sickle cell. So in Kenya, the coastal region and the western region, the lakeside area is where we have malaria, and it is where we have sickle cell. And we are in the coastal area. So that's why we have high numbers of people carrying the sickle cell gene in Taveta.
Oh, wow, Lea, those statistics are so heartbreaking. And no doubt it's in areas that are also suffering from poverty that's really exacerbated and lack of access to healthcare. Can you share for us what life is like for people every day who are living with sickle cell?
Okay, if it's a child, they have chronic pain, their fingers and their hands swell up. They have chronic jaundice, very high fevers. So they are in and out of the hospital for pain management, for blood transfusions, for hydration, and for diagnosis that usually are not accurate or are not actually detecting sickle cell. So those people who don't know have sickle cell are maybe going to the hospital and being told they have something else like malaria instead of sickle cell. Usually it will take a couple of years, especially if an area does not understand the condition, for this patient to be diagnosed. And this will cause a lot of complications. Complications with the liver, with the spleen, with the chest, the lungs.
Wow.
Until eventually the case is taken to a place like Nairobi or a city that understands the severity of the case for them to diagnose them. And of course, at this time, it's very late because they have developed multiple complications that would have been avoidable if the person was detected early for sickle cell. And if they are much older, if they are able to survive beyond the age of 5, then in some cases, they are living with disabilities. They're living in a situation where they cannot be able to attend school because their conditions are so severe. The primary caregiver has to stay at home to care for this child. Therefore, she's not earning a living. Aside from contending with the physical debilitating complications of the disease itself, the patient, the household, and the community contends with the social effects of stigma with sickle cell, the poverty that comes from sickle cell, the lack of access of basic social services that comes with not being able to be economically and financially able to afford these social services, especially if you are in a rural setting. It's a complex cocktail of conditions that now make it very difficult for a patient and even the household to thrive because they have this person in the home.
Oh my goodness, that's huge, Lea. You can really see that there's such a clear need for advocacy and information about sickle cell to be made available to not just the society, but to healthcare providers as well. Can you share with us how you first got into your advocacy work around sickle cell?
I felt the health system did not care about me, did not care about me and my family and my sisters and the people who live with sickle cell. It was assumed that there were no people with sickle cell because I don't know why they assumed this, but whenever I went to hospital, there were so many children with sickle cell and I was wondering, why is it that there's no understanding or care and priority for this disease? And that's when I was like, let me go out and take 10,003 photos of people living with sickle cell because I think 10,003 will actually make them stop and plan for us. It's a big enough number for them to be able to take notice. So I went out across Kenya, all the places that I knew for sure sickle cell was there. And imagine me, someone who is in the first year of university, knows where sickle cell is, and the country doesn't agree that there is sickle cell. So I went out and took photos across the different areas of people living with sickle cell, children and caregivers. And the situation was worse than I could have ever imagined because only 5% of all the people that I photographed had access to care. I did not reach the 10,003. reached 400 because the situation was so dire I could not continue. But 5% of those 400 had access to care. And half of those 5% had access to continuous pain management, meaning that they will be able to access pain management for sickle cell anytime they have crisis. But most of them were either locked in rooms, in outside homes, because their cries and their insistent mourning made their parents helpless, that they had to seclude them in rooms because they couldn't do anything about their pain.
Oh, wow.
And 100% of the people that I photographed did not have access to health insurance, meaning they couldn't afford to go to the hospital. And it was sad. It was sad because I went and I found a family where a child with sickle cell was completely abandoned, not taken to school, not given good clothes because the family knew that they will eventually die. So they did not really invest in them. And it was bad and I couldn't continue. So I came back to Nairobi and I think that's when it was heavy on my spirit that I needed to find this person who allowed this very upsetting situation to happen and allowed people to live like this. So that was when I looked for the person who was in charge of sickle cell in Kenya. And this was the head of the non-communicable diseases department, where from cancers to diabetes to asthma to epilepsy to sickle cell. And I told him about the project. He received me very well. This was an open door kind of office and congratulated me, gave me his contacts and sent me on my way and told me they'll call me back. But he did not call me back and I was frustrated. I could not live with myself with this heaviness. So I was like, how will I be able to get his attention? I tried calling, I tried emailing, I tried going to the office. It was not available because the man was extremely busy. Yeah. If you're handling all those diseases. Yeah. So I was like, okay, I'll do this. I will send a photo a day to this man's WhatsApp of all the stories that I gathered.
Nice.
This is cool.
And I will see, at least I will have done something. At least I would have done something.
And so he received all your photos?
Yes. Day one, I sent a story of Mary, a mother with 3 children, 2 of which have sickle cell. Both of them experienced strokes while they were young. So they cannot walk, they cannot eat by themselves, they cannot speak, and she needs to care for them full time. So she doesn't have a means of earning a living and she doesn't have a means of accessing care. What are you going to do about her? Second day, this is David. David succumbed to blindness because of the lack of access of sickle cell care. He is in a family where he's not given the care that he deserves because the family does not understand sickle cell. They have stigmatized him and he lives in a very deplorable condition. What are you doing about him? Day 3, this is Eunice. She is a mother of 2, but she has sickle cell. But over the years, she has developed double necrosis of the hips. She cannot earn a living regularly. She cannot work. She cannot walk far distances. How are you helping her educate her 2 children? And how are you helping her access care for sickle cell? This was when WhatsApp was very new. You couldn't block anyone. You couldn't mute anyone. Every day I sent a story. And after about 7 days, he told me, Lea, you're very persistent. You're making things uncomfortable for me. Come in, let's discuss. And it was that time that we got the WHO, the World Bank, and funders and partners who are working on sickle cell. And we raised an initial $20,000, developed the national guidelines for management and control of sickle cell disease in Kenya. This is a document and a policy document that says whenever a person goes to a public government facility or even a private, this is how they should manage. So it was a very big step. And this was launched in 2021. That was 2014. So policy takes time.
Wow.
At least that's how I started.
Wow. That's so powerful, Lea. That's so powerful. Oh, you're amazing. So you've talked about your wonderful advocacy work to put sickle cell on the agenda at a national and even international level. What kind of work are you doing at the community level?
The first thing is that we co-create sub-national sickle cell programs that provide access to early and continuous sickle cell care, access to clinics, essential medicines, labs, chronic care management in public facilities within the community.
Brilliant.
We do a vulnerability assessment. And based on the vulnerability assessments, we have targeted poverty interventions and targeted household interventions for the patient and the household.
Fabulous. And you're also doing some work to raise awareness within the community about the prevalence of sickle cell.
Yes.
Could you talk a little bit about that?
Community awareness and education is an overarching component across our programs. If sickle cell is stigmatized, then a lot of the patients and a lot of the household will not come out and seek care. So for us to improve health-seeking behaviors, we have to continually communicate, educate, and create awareness that sickle cell is not witchcraft, sickle cell is not a curse from your ancestors, sickle cell is not a shame or a stain on the family, but it is a condition that can be managed through care.
Wonderful. I love how your work is so holistic, Lea. You spoke there about encouraging people to seek healthcare, which is really important, especially when stigma's involved. What kind of access to healthcare is actually there for people who are seeking it and are suffering from sickle cell? And is it expensive?
Yes. So for the cost of care, it has been estimated and it has been calculated that for comprehensive care of sickle cell for children costs about $10,000 annually, and for adults goes up to $30,000 annually.
Wow.
Yes. In Kenya specifically, it has been estimated that it costs the country 1.6 billion of GDP expenditure not treating and not addressing sickle cell. So it's very costly for the patients and for the health system.
Yeah, absolutely.
Because sickle cell has been neglected for years, the healthcare infrastructure has not developed to respond to sickle cell. So now you have to educate clinicians, you have to ensure there's access to essential medicines, ensure there's access to specialized care, because if something is affecting the blood, then it's affecting all the major organs. So you need to have specialized care for all major organs. And that is not cheap. It is better to diagnose the patient early so that you can prevent a lot of these complications. And when we say early, we want patients to be diagnosed within the first year of birth.
Okay.
Yeah. Is there some kind of screening that could happen if it was available within the first year of birth?
Yes, newborn screening programs are important because when you are diagnosed very early, you're linked to care very early and your health outcomes become very positive, preventing a lot of complications, physical disabilities and physical manifestations of the disease that would occur because people do not know that you have sickle cell. So that is one of the main interventions of sickle cell, newborn screening.
Yeah, that makes sense.
Yeah.
But then if it is discovered that a newborn has sickle cell, they can only receive treatment then if their parents can afford it. Is that right? You're saying it's $10,000 a year. That would exclude many families from accessing care.
Very many. Majority will not be able to access care.
Is the reason why it's so expensive because there's not enough awareness around sickle cell and there's not enough investment into it, or the medicine's not being mass produced, or what's the reason for the cost being so high? And do you think that it's possible that it can come down?
Yes. So because there has not been historically investments in sickle cell in sub-Saharan Africa, meaning because the prioritization for sickle cell happens within the country, but the prioritization within countries and within governments usually follow global prioritization.
Mm-hmm.
And globally, because sickle cell has not been largely funded by the very big global health funders, then African governments are unlikely to prioritize because there's no funding coming to sickle cell from the global funders. Sickle cell has been systematically left behind because of the global prioritization, how money moves within the global health system, and what specific diseases are prioritized across communicable and non-communicable diseases. So without this funding and without this financing, the health system is not resilient to understand sickle cell, to respond to sickle cell, to diagnose sickle cell, to manage sickle cell across the patient continuum, meaning across birth, like from 0 to being an adult, okay? It's a whole development issue that needs to be resolved in a systematic way to create awareness, to increase investments and funding, and to be able to now encourage pharmaceutical partners to be able to provide more varieties of sickle cell medication, to have cheaper diagnostics, machines and equipment, unpack sickle cell and medical school so that we do not have to incur another extra expenditure to train doctors so that the cost can eventually go down.
Thank you for that. So you have sickle cell disease yourself, and it takes such a huge toll on your body. So what was it that made you take on the challenge of becoming an advocate for sickle cell patients when it's so difficult for you just to live a normal life? What motivates you to take on the huge challenge that you do with your work?
So I was born in a home where 3 of the 4 children have sickle cells. So my eldest sister, the sister after that have sickle cells, and then me. My elder sister unfortunately succumbed to sickle cell at the age of 4. My older sister, the one that I follow, was fortunate enough to move to the US for better health care. She has better opportunity to get a more specialized sickle cell care where she is. And myself, I was left to contend with the current healthcare system, which did not mature the way I matured, because a lot of the people did not make it beyond the age of 5 then. It has been a slow process for the healthcare system to move beyond providing care for children and adolescents to understanding the dynamics of being a young adult and a mature adult with sickle cell. As much as I experience the complications of sickle cell, I feel like it is based on my experience living with sickle cell, living in a family where majority of the children have sickle cell, and in a community where there's high sickle cell burden, to try and make a difference or to try and change the situations for those that are coming after me and for my children.
Wow, that's an incredible mission to have in life, and so courageous of you to decide to take it on, given all of the challenges that you faced in your life physically and perhaps with other factors, including economics and lack of access to care and all of these other things that shape the conditions of your life. And then you take on such a wide mission that's going to affect so many people. It's really inspiring. So I wonder, what would you like to achieve within your lifetime? What's the big overall goal?
My goal is for everyone with sickle cell, born yesterday and born tomorrow, to be able to thrive in spite of sickle cell or because of sickle cell. Meaning, having sickle cell should not determine whether you are able to survive to your adulthood and survive a life that is full, a life that allows you to raise a family, allows you to have the things that a normal person should have. So for me, it is that sickle cell should not be a hindrance for someone's enjoyment and fulfillment of life, but should just be an added thing that can not only empower them to do better, but also empower them to do better for others. Because this is a genetic condition, Christy. And there's a large likelihood that your children will have sickle cell. So you thriving in life ensures that your children thrive in life. But if the cycle is that I live in a situation where I don't thrive, then it means I am creating a precedent for those who come after me not to thrive.
Wow, wonderful answer. Thank you, Lea. Now, I don't want to be too personal here, so just answer what you want to answer. But the last thing you said was very fascinating, that if you don't thrive in your life, then you're setting a precedent for the next sickle cell patients not to thrive also. So you want to thrive and create a world where sickle cell patients are able to live normal, fulfilling lives. So do you think that you are thriving in your life now? Have you achieved that for yourself? And do you plan to have a family, knowing that there's a high risk that your children would carry this disease as well?
Oh, Christy, that's a beautiful question. And thank you for asking it. A lot of the decisions that I make with regards to how I solve sickle cell within our community and how I would want someone to solve sickle cell for me are largely based on the fact that I want children in the near future and I want a family. So because I want children, this is a sensitive topic because first there's the question of telling your partner that you need to test for sickle cell. And if you have sickle cell, then it is highly unlikely that we will be together because our child will have sickle cell. For me, that is very unethical. For the programs that we are doing in the community, we like to have genetic counseling during adolescent reproductive health education so that we do not break up two people who are incredibly in love, who have found love in this world where at this time may be difficult to find, especially for people living with sickle cell, that now you cannot be together because you have sickle cell. I think that is unethical. Personally, I'm very aware and I'm very open about having sickle cell, and the people that I have intimate connections with understand the dynamics that I need to consider. However, that is not the end and the final say of what will determine if I have children or not. I cannot say that I will not engage in a relationship because someone has sickle cell. Ideally, I would not look for someone with sickle cell, but sometimes people are carriers. You don't know they have sickle cell until they test. And that's where I won't say the challenge, but the conversation will have to take place. So I am a very open human being and I'm very clear with what I want and what I need and the reality of the matter. Living in a home where 3 children have sickle cell, it may not be wise for me to have children who have sickle cell, but also it may not be wise for me to tell people with sickle cell not to be together. So I think this is a very personal decision. I will not drive someone's opinion one way or another because of my own personal choice. I do not see people with sickle cell less than. So when the time comes, I will know. Let me say that.
Yeah, wow. Thank you so much for your openness and answering Christy's questions so honestly, Lea. It gives a real insight into the added complications that come into the lives of people who have genetic conditions, and the extra thought that needs to go into family planning, which is already such a sensitive topic, even for people in full health.
Thank you so much, Lea, for sharing your insights and your experiences with sickle cell disease and the incredible work that you're doing to make the patients visible in the world, to bring their stories out and to help them all access the care that they need to live, as you say, normal and fulfilling lives.
Thank you, Christy, and thank you for asking such well-thought-out questions so that we can create awareness of this.
Thank you so much, Lea. It's been an absolute pleasure to chat with you today. For anyone listening in who's interested to learn more or support Lea's vision, you can visit justpeoples.org/leaders/Lea. You can find these details in the show notes.
To give you an idea of how your support could help Lea realize her dream of creating a fully inclusive society for sickle cell patients, around $3,500 would enable Lea to address the needs of a community that has a very high rate of sickle cell disease by bringing stigmatized patients out of marginalization, establishing a local support group, and providing them with a pathway to medical treatment and care so they can begin to live their lives fully with dignity and support. Lea, we are just blown away by your courage and your strength and how much you've managed to achieve against the odds. What is it that keeps you going?
Anytime I get to interact with patients and show them what's possible, empowering them to ask for more, to ask for better, to ask for their rights, to want better care, to want better lives.
Why Give a Buck is proudly brought to you by Just Peoples, an international nonprofit that connects givers directly with local leaders at the forefront of tackling poverty in their local communities across Africa and Asia. You can learn more and directly support the work of Lea and other inspiring leaders by visiting justpeoples.org.